My name is Margaret Kiburi. I'm a Ramka Family Planning Technical Lead with USID Fahari ya Jamii, the project which is being implemented by the University of Nairobi. I'm in the cohort of 2024 Thematic East African Leadership Journey, and I'm going to take us through a project I did during my leadership journey on scale-up of postpartum family planning in Nairobi City County. Presentation outline. I have introduction, project progress, impact of growth in leadership, connecting the dots and sustainability momentum, leadership journey framework. What led to the implementation of the project? The theory of change is to increase the uptake of postpartum family planning among women within the postpartum period. The scale-up of postpartum family planning integrates services into maternal newborn child health services, leveraging touch points, training healthcare providers, and engaging communities to improve maternal health outcomes. Why was it important? To reduce maternal mortality, reduce unintended pregnancies by addressing postpartum contraceptive needs. This inspired my passion for empowering women through contraceptive autonomy. How was it implemented? Integrating postpartum family planning into maternal newborn child health services, addressing sociocultural barriers, leveraging digital tools to increase community literacy, fostering partnership to ensure scalability and sustainability of the impact. The outcome: enhanced healthcare provider capacity, increase in service coverage and contraceptive uptake, measurable outcomes with ongoing evaluation, tracking key performance indicators, and long-term maternal health impacts. The project progress. This data is from January to November 2024, and it has been lifted from the Kenya Health Information System platform. From January to June, we have before implementation, the linear graphs are representing the skewed birth attendance by the right blue linear graph. The royal blue linear graph is representing postpartum family planning services within 4 to 6 weeks. And then we have the mustard yellow linear graph representing postpartum family planning services within 48 hours, or the postpartum that we refer to as immediate postpartum services. During the implementation, we trained 60 healthcare providers. We also sensitized 120 healthcare providers. We also sensitized 60 community health assistants, and the community health assistants were mandated to sensitize 10 community units, where each unit comprises of 10 community health promoters. Community education on postpartum family planning targeted 6,000 community health promoters and 150,000 households. The success of the project. This came about because of support from Fahari ya Jamii team, support from the county and sub-county health teams, and also the willingness of implementation by the healthcare providers that were trained. The challenges during implementation. There were raw stocks and stockouts of family planning commodities among the 12 facilities that were scaling up the project. Transfer of trained healthcare providers to other facilities that were not implementing the project. Short duration of implementation period. Impact of growth in my leadership. Within the 4 pillars, the authentic leadership, I demonstrated a genuine commitment to postpartum family planning goals by aligning actions with core values such as improving maternal health and reducing unmet need of family planning. Inclusive leadership. I fostered a culture of collaboration by engaging diverse voices, including healthcare providers, policymakers, and community members. Strategic leadership. I developed clear strategies and priorities to scale up postpartum family planning efficiently while navigating the challenges. Impactful leadership. I drove measurable results and positive outcomes in postpartum family planning scale-up efforts. Connecting the dots and sustainability momentum. The project goals have pushed me to grow as a leader, enabling me to drive the scale-up of postpartum family planning through collaboration and leadership development, building capacity, leveraging data, fostering partnerships, and sustaining personal leadership growth. I create a cycle of continuous improvement and momentum within Nairobi County. The result is resilient and impactful in this program that thrives beyond initial implementation and leadership that evolves alongside it. My next steps is to continue with the implementation of this project even after liftoff, share the outcomes of the project with county and sub-county health teams, advocacy for scale-up in other maternity units within Nairobi City County. Leadership journey framework. I was able to discover in authentic leadership my leadership strengths, strengthen my voice, lead with purpose. I was also able to connect inclusive leadership, enriching my mindset, ally and amplify, and inspiring action. I was able to energize in strategic leadership, leveraging my power and leading change. Impactful leadership, I have developed others in leadership. I'm ready for liftoff. Thank you for your time.